Hi everyone, it's Brooke from Active Health Clinic here. I wanted to chat today about cognitive dysfunction and brain fog. And I just wanted to take a moment to assure you, you are not in the early stages of dementia. You are not losing your marbles. You are not dumb. You are just a little bit slow. So it all comes down to the brain and what state your nervous system is acting in. People with invisible illnesses, it's actually been shown that we have a abnormal resting state. So instead of resting down low in our rest and digest, we're more often than not in fight or flight. We are always waiting for that next threat. We're waiting for the lion to run out of the bush and chase us and kill us, sort of thing. So therefore, the amygdala down here, this little green thing, is always switched on. The amygdala is responsible for assessing your surroundings. It is responsible for the fight or flight response. It is responsible for storing traumatic events in history. And when we are in that fight or flight response, it becomes very, very strong. Okay, it's always on. So the hippocampus here and the prefrontal cortex over here that are responsible for regulating your memories and emotions and responsible for thinking and logic and problem solving, they become weakened. So up here you can see weakened, and down here this one becomes stronger. So we are more often than not in this emotional brain. So this state down here in the emotional brain, the fight or flight response, actually requires a lot of energy expenditure. As I said before, you are constantly evaluating your situation and determining, is there threat or is there not? Okay, so lots and lots of energy. So this is also why you have problems concentrating, problems with decision making, and remembering why you went into that room. So your brain is stuck on this survival mode. You're using this part. All of this is weakened and switched off. So you are having problems integrating your thoughts, problem solving, and recalling what you were doing. So when it comes to actually sitting down and problem solving and performing that simple task, you're actually recruiting a lot more of your brain to do that as well. So there's been research that shows, like under an MRI, people were asked to perform a cognitive task. Under MRI, when they were asked to do that and actually sat down to do the problem, more parts of their brain lit up like a Christmas tree. So you are actually using a lot more energy to perform those tasks. So more cognitive energy expenditure. Also, when we are in this state down here using our amygdala, we're in fight or flight, blood flow is actually changed. So it's moving away from our central nervous system, which is our brain and brain stem, moving more towards our peripheral nervous system. So that's our limbs. So blood flow moving to our limbs, which means it's away from the brain, and therefore reduced blood flow to the brain. Now, this is all normal. It is all necessary for us to function. However, in the population that we treat at Active Health Clinic, it can actually become a little bit inappropriate. So that part of the brain gets stuck on, and we have problems reintegrating this part of the brain. So what can we do? How can we beat brain fog? How can we cognitively recharge and remember what we went into that room to do? This is where pacing comes in, really important. So making sure you are having shorter demands, so you are performing the cognitive task, but with more frequent breaks. Also making sure you are not multitasking. That's definitely going to do it. Breathing, mindfulness and meditation is also a direct way for us to access our autonomic nervous system. And it has actually been shown in research to strengthen this part of the brain. It helps us reintegrate that prefrontal cortex, strengthen it so we're moving away from the amygdala. Also surrounding yourself with people that are more regulated. It's probably not the best way to put it, but people who they're calm. They have that calming sort of vibe. What that does, it actually teaches our nervous system how to regulate itself. We have these things called mirror neurons. So when we see someone else acting quite abruptly or quite irrationally, we mirror that. So if we're surrounding ourselves with people that are regulated, have their shit together, we are more than likely going to mirror that and slowly over time strengthen our prefrontal cortex. But it also comes down to the other things that we are surrounding ourselves with in our environment, our safeties. Make sure you are doing things that keep you calm, they provide you with comfort and joy. It's brain fog, cognitive dysfunction is one of the last symptoms to kind of disappear after we start treatment at Active Health Clinic. It's all about being patient. It takes time, like it does time with muscles, to strengthen this, okay? It takes time to build that strength. That's essentially what we're trying to do. So thank you for listening, and I hope you enjoyed.